Nursing 2. It's a theory course with 2 units. Okay, great guys. So what is the purpose of this course, guys? The purpose of this course is to equip the learner with knowledge, skills, and the necessary attitude to manage congenital, pediatric emergencies, and the terminally ill children. What are the expected learning outcomes? Okay, what do we expect from you? You need to be able to discuss the nursing care of common health problems and disability among children. You need to also describe the clinical features of congenital and acquired childhood illness. You need to be able to explain the concept of IMNCI. And lastly, we need you to demonstrate competence in management of pediatric emergencies. About the course content, we're going to look at the definition, pathophysiology, prevention, management of complications and conditions relating to children and infants. We look at dermatological disorders, viral in nature, fungal, bacterial, conditions such as impetigo, papilloscomal reactions, dermatitis, and erythema. Disorders of pigmentation such as albinism. We'll also be looking at burns and metabolic disorders associated with it, connective tissue disorders, neurological disorders, orthopedic condition, and oncologic conditions. Congenital malformation to include congenital heart diseases, cleft palate, cleft lip, hydrocephalus, esophageal and tracheal atheresias, spina bifida, the tallips. We'll also look at pediatric emergencies, pediatric intensive care, conditions like poisoning, foreign body aspiration, respiratory distress, hypoglycemia, cardiopulmonary failure, shock, fluid and electrolyte imbalance. Then the integrated management of childhood illness, IMNCI. So that we're going to look at the historical background of it. We'll also look at the checklist in managing malaria, respiratory diseases like acute respiratory tract infections, pneumonia, tuberculosis, asthma. Also diarrheal diseases, malnutrition, anemia, intestinal worm infestations, accidents. We'll also be looking at AIDS. Then we look at risk children, those with failure to thrive, children with septicemia, mental retardation, Down syndrome, autism, and ADHD, genetic counseling for parents or couples with suspected genetic problems, abused child, a child of substance dependent, the dying child, and lastly we look at the role of family on the child's health, okay, and care for the terminally ill children.